You see the ads and testimonials for LASIK eye surgery everywhere. Seems everyone is having it done, but it is surgery and there are risks. News 12's Chandra Bill is here to tell us doctors are just beginning to learn this procedure is far from perfect. Chandra?
That's right, Liz. This is a story for anyone who has had LASIK surgery, like me, and anyone considering it. Complications can happen, and your ophthalmologist can tell you about most of them, but what he probably won't tell you about are the possible long-term complications. And it's not because he's hiding anything, it's because he may not know.
Excited. It was like a facelift. It really was amazing to see for the first time in 20 years without glasses.
That's what every patient who has LASIK hopes to achieve.
Oh, it was horrible. I was terrified. What happened was when I was in the surgery, when he started to cut the flap came totally off.
Dawn Pitts is among a growing number of people who experience a LASIK complication. In her case, surgeon error, but it was correctable. About 1 in 5 LASIK patients will need surgery again to have problems fixed.
You'd have a seat right here in the big chair.
That's where corneal specialist Dr. David Cano comes in. He believes not everyone who wants LASIK should get it, particularly patients with unrealistic expectations, chronic dry eyes, or large pupils also.
I think patients who aren't good candidates are patients who have high degrees of correction and also have thinner corneas.
Thin, weak corneas, remember that. First, an explanation of how LASIK works. The doctor shaves a thin slice of the cornea, lifts it up, performs the laser correction, and lays back the flap. Dr. Percy Amoyles, a South African ophthalmologist, is leading the charge against LASIK.
If I was asked the question, would I let any member of my family have this operation, the answer is no, because I feel that the long-term results can be serious.
Dr. Amoyles believes the cornea never heals. It will weaken and eventually bulge, and the only way to regain your sight is by wearing hard contacts. Nothing else works. The problem is called corneal ectasia. How do the U.S. experts respond to that?
Dr. Moyles has some credible arguments. In our own group of data from the United States, corneal ectasia is very uncommon, although I think there needs to be concern.
So, should you be worried if you have had LASIK? Should you delay upcoming surgery? Probably not, but take this precaution.
All ophthalmologists should measure the thickness of the cornea before doing the surgery, mainly because you need to know whether or not you have that safety zone.
The key is to be an informed patient, isn't it?
Absolutely.
Knowing the risks and having gone through a complication, what does Dawn Pitts think?
Would you recommend LASIK surgery to someone else?
Highly,
really?
Highly recommend it. But I feel that, you know, it's worth it to see 20/20.
Well, later this month, on May 21st, the American Society of Cataract and Refractive Surgery is meeting in Boston, and that is when Dr. Percy Amoyles will present his findings, so we may hear more on that. In the meantime, if you want information and testimonials about various corrective procedures, you can log on to our website at WPECnews12.com. Just click on the Lessons in LASIK link. Kurt?